Thank you. Good morning, everyone. My name is Joseph K Tatuene. I'm a neurologist and a stroke researcher, and it's my pleasure to give you a summary of our study entitled Circulating Interleukin-6 Predicts Carotid Plaque Severity, Vulnerability, and Progression in the Cardiovascular Health Study. So in this study, we uh, we wanted to test the hypothesis that there is a relationship between circulating levels of inflammatory markers, notably interleukin-6, and features of high-risk carotid atherosclerosis. This hypothesis came from the fact that when looking at trials that investigated the effect of anti-inflammatory drugs for cardiovascular prevention, for example, the CANTOS and the CERT and the CORCO trials, there was a benefit for the prevention of a composite endpoint of myocardial infarction, stroke, and other cardiovascular events and cardiovascular death. But when looking specifically at stroke events, the trials, all those three trials were neutral or with only marginal benefits. So we had the hypothesis that most of the stroke events recorded in those trials were probably related to other causes than carotid atherosclerosis or large vessel atherosclerosis. So to test the hypothesis that there would be a relationship between IL6 levels and features of high risk carotid plaques, we access the database of the Cardiovascular Health Study, which is a prospective population-based cohort study in the US that was initiated in the 90s and enrolled patients aged 65 and above. And they did carotid plaque assessment at baseline using ultrasound, and then at 5 years after a 5-year follow-up. They also measured the levels of interleukin-6 in plasma at baseline using enzyme-linked immunosorbent assay. And they define carotid plaque severity using the NASCET criteria. And this was called 0 to 5, from 0 to normal, meaning normal carotid, to 5, meaning occluded carotid. And they also define plaque vulnerability as mildly irregular carotid plaque, or ulcerated carotid plaque, or echolescent carotid plaque. And then they define plaque progression, or we define plaque progression using their data as a 1-point increment on the plaque severity score between baseline and the 5-year follow-up. There were in total about a bit more than 4,000 patients that were included in the study with complete data to do the analysis. And we studied the relationship between circulating levels of interleukin-6 and the three features of carotid plaque that I just mentioned, using regression, multivariable regression models. We use linear regression for plaque severity and logistic regression for vulnerability and progression. And all the models were adjusted for cardiovascular risk factors and use of anti-inflammatory drugs or statins. The main findings were that interleukin-6 is independently associated with carotid plaque severity, plaque vulnerability, and plaque progression. And this was a linear dose response association. And we found specifically that there's a 12% increase in the risk of in the probability of plaque vulnerability per standard deviation increase in the levels of log interleukin-6, and a 24% increase in the probability of plaque progression at 5 years per standard deviation increase in the levels of log IL6. We also found that hyperuricemia is an independent predictor of plaque severity and plaque vulnerability. So as a take-home message from this, we think that the contribution of inflammation to plaque destabilization and plaque progression is independent of that of dyslipidemia, and therefore anti-inflammatory drugs could be trialed to improve the prevention of stroke or other cerebrovascular events related to carotid atherosclerosis, and also decreasing the level of hyperuricemia to improve stroke prevention in patients with carotid atherosclerosis also warrants further study or further evaluation. And we hope that the findings of this study will lead to the implementation of new trials and maybe later on new management guidelines for patients with carotid atherosclerosis. Thank you for your attention.